Hello, I hope you're doing well. This is another day that God has given unto us, and we are to learn something very important that is so rampant in the society. And today I want to educate all of us on how do we get ulcers. How do we get ulcers? That is what we call stomach ulcers, gastric ulcers, peptic ulcers. We need to understand how they come in so that we can be able to prevent. And if we have stomach ulcers or whichever ulcers, we will sort you out. Today is the second day of December, and I want us to understand how stomach ulcers, or what you call gastric ulcers, come in, or duodenal ulcers. The stomach, this is what we call the liver. Okay, the liver is just next to the stomach, and on the stomach we have got near the stomach we also have got what we call the pancreas. So when you have stomach ulcers, they appear within the stomach walls. When you have what we call duodenal ulcers, they just come just after the stomach. Just after your stomach, that is what we call duodenal ulcers. Just at this point, that's what we call duodenal ulcers. In reference, duodenal ulcers and stomach ulcers, at times, or many times, they are referred to as peptic ulcers, especially when they have become now chronic. I want us to understand just some basic, that the liver does what we call metabolism, and it helps the indigestion by producing what we call the bile juice. It produces what we call the bile juice, or what we call the bile salts, and these bile salts are basic in nature. Okay, they are basic in nature. And then the gastric walls produce what we call gastric juice, which is acidic in nature. Remember, ulcers are produced by a bacteria that we call H. pylori or Helicobacter pylori. This bacteria is not stopped by the gastric juice or the acidity of the stomach to thrive. Actually, it thrives within the acid, because it is able to produce what you call urease, and then urease is converted to urea, and then it is able to survive the acidity within the stomach walls. Now, when you interact with contaminated food or water, this one comes when there is no enough hygiene, then this H. pylori can be transmitted from one person to the other, even through saliva, through a vomit. So number one factor is that we need to maintain cleanliness. You know, when you're going to a hotel, when you're going to a resort, when you're going to take your food at home, ensure that cleanliness is at high level. Number two, what causes now the ulcers is when you take what you call painkillers. When you take painkillers for a long time, or what you call non-steroidal anti-inflammatory drugs, it can cause what you call stomach ulcers. So those two factors. So stress has not been verified through research to cause ulcers, but stress can accelerate, because when you have stress, you find yourself at most of times you don't have what you call appetite. And when you don't have appetite, it means you are going to end up skipping meals. Okay, when you skip meals, there's going what we call acid reflux, and when acid reflux comes in, it is going to irritate the stomach walls. Remember, H. pylori attacks the stomach walls, okay, removing what we call the mucus lining, removes the mucus lining, gets into the walls of the stomach, then causes an ulcer. And that ulcer is what we call the stomach ulcer. So the other factor that accelerates, except from skipping meals, it is through smoking. Okay, when you smoke, you accelerate the chances of the ulcer to go higher. When you excessively take alcohol, you always make that your stomach ulcers goes high. Then the use of acidic foods, it is a high time that when you notice that you have ulcers, reduce the intake of acidic foods, and then at least you can be able to alleviate some simple things to do. When you have stomach ulcers, some simple things to do at home is that you need to be taking enough water. Okay, take enough water. Number 2, you practice sleeping on the left. Practice sleeping on the left, which is able to drive the acid to the lower side of the stomach, and then you reduce the pain. The other one is that you need to be taking fiber, enough fiber, foods with enough fiber, which is going to help peristalsis. Then the other thing that you need to consider is to avoid skipping meals. Okay, you can take small bits, but many times. For those who have got stomach ulcers that have been chronic for probably many years, please, you have our number, contact us, and we will be able to sort you out, and you will be free from your ulcers. How do we treat the ulcers? What we do is that we give you medicine that is able to accelerate production of bile. Okay, the bile salts. When they get accelerated, it means you're going to have enough of bile, which is basic, to neutralize the acid within the stomach. That's one thing. And now your digestion is going to be fine. The pain comes down. Number 2, we give you medicine that's able to bring back this stomach lining that was destroyed by H. pylori. Then another medicine that strikes out the H. pylori, and wholesomely we are able to clear your stomach ulcers. Give us a call and you will be free from ulcers. God bless you. Enjoy your day ahead.